So welcome everyone to today's Dissemination Research and Implementation Science seminar. I'm Heidi Brown, one of the D&I Launchpad faculty, and I'm the moderator today. This seminar, DRISS, is a new seminar that we've done just this academic year. It's meant to be interactive and meant to foster learning about the growing science of dissemination and implementation. We're really glad you're here and hope you'll continue to join us for future sessions. We will be taking the summer off and we'll be resuming again in September. You can join the DRISS mailing list by clicking the link in the chat, which I believe John is going to post for us. And it's my pleasure today to introduce as our speaker, Dr. Andy Garbitz, who will be presenting today about promoting family well-being and youth mental health through family-centered and family school community intervention. Dr. Garbitz is a new member to our D&I Launchpad faculty. We are so thrilled that he's joined us, and an associate professor and co-chair in the UW School Psychology program in the School of Education. Dr. Garbitz is a licensed psychologist and a nationally certified school psychologist and serves as co-director of the School Mental Health Collaborative, which focuses on conducting research that informs policy and practice to promote the social, emotional, and behavioral success of all students. He is also co-director of the Family School Community Alliance, a national organization focused on advancing partnerships among families, schools, and communities to support family and professional wellness, as well as children's mental health. His research focuses on mental health promotion and optimizing implementation of mental health interventions in schools and community settings to center equity and improve adoption, implementation, and sustainment. We are so thrilled to hear from Andy today. He'll present for 30 to 40 minutes, and then we'll have about 20 to 25 minutes for questions and discussion. And now I'm going to turn it over to Andy. Andy, thank you so much for being here.
Yeah, thank you very much, Heidi, for that very kind and generous introduction. I'm really thrilled to be here with you all today. I'm very excited to have this opportunity to be in conversation with you all about a topic that's very near and dear to my heart, promoting family well-being and youth mental health through family-centered and family school community intervention. So I'm glad that we have some significant time during the course of our hour together reserved for questions and discussion. I'll also just share that as I'm talking, feel free to jump in with any questions that you might have. I'm glad to talk through things as they come up as well. So with that, I'll just
We'll just ask you to either use the Q&A or the chat function for your questions, and then we will elevate them to Andy's attention so that you can, we've disabled the ability for folks to unmute themselves without our permission. So just let us know in the chat that you want to interact and we will foster that interaction. This was a security measure we had to take after an unfortunate situation a few months ago. So we still do want to make this interactive. You just got to chat at us first. Thanks so much, Andy.
Great. Thank you, Heidi, for that direction. Okay, so I will just kind of launch into some of the content for this afternoon. So this is a brief roadmap of what I hope that we'll have a little bit of time today to cover. I'll start out with just a little bit of background and context to this topic area. I'll talk through the procedures and some analytic details of our work for this line of research. I'll describe some findings and results, and we'll talk through some discussion points and possible implications. I certainly just want to acknowledge that this is the projects that I'll be sharing with you today are certainly team efforts. I get the honor of sharing the findings and some of the work with you, but certainly this has included teams of individuals across institutions over several years. Also want to express my gratitude to the Institute of Education Sciences that supported this project and many of the projects that I'll be describing today. So as a bit of background and context, I'm going to be talking about family school interventions during the middle school time period primarily, or during that early adolescent developmental period. And so just as a brief background to that early adolescent developmental period, we really see during adolescence that it's really during this time that children develop more serious and sometimes intractable social, emotional, and behavioral concerns. We find that early adolescent developmental period is a critical time to identify teenagers who are struggling with mental or behavioral health concerns and provide access to effective treatment for those social, emotional, and behavioral concerns. Because if we don't provide easy access to effective treatment during this time, we see that these concerns only continue to amplify or escalate into adulthood. Prevention and early intervention during early adolescence is often best addressed by including families as key partners and collaborators, and by building connections across key ecological contexts for teenagers. So by creating positive connections across home, school, and other community settings, we find that we can address concerns that might be coming up for teenagers and reduce the risk of those concerns becoming more serious over time. So these are just a couple charts that depict this escalation that we see during 6th, 7th, and 8th grade. So I'm just showing here substance use and affiliating with peers who engage in rule-breaking behaviors. We see that associations with these two issues tend to contribute to that amplification over time of more serious, whether it's mental health concerns or substance misuse issues or substance abuse issues. And so, but we see that if we are effective at promoting more positive, intentional, authentic family school connections during this early adolescent developmental period, we see improvements on youth engaging in peers who are more positive influences on their life. As we know, during that kind of early adolescent period, that other peers play an increasingly important role in their lives and are primarily a gateway to more kind of concerning activities, rule-breaking behavior, substance misuse, substance abuse, that can then amplify social, emotional, or mental health concerns, whereas engaging with peers who are engaging in more positive activities tend to reduce the risk of those concerns from coming up. And we find that through this kind of family school connection at 6th grade, we see reductions into 7th and 8th grade in terms of affiliating with peers who are engaging in rule-break behavior, and increases in affiliations with peers who are engaging in more positive behaviors. This chart just shows it the 7th grade, but we've seen this finding into 8th grade as well. And this is just a chart that shows the impact of a family school intervention implemented during at 6th grade on later GPA, grade point average for students into 11th grade. So essentially what this chart is telling us is that children whose families engaged with a family school intervention at 6th grade were less likely to have a significant reduction in their GPA into 10th and 11th grade. And so we see a lot of benefit associated with family school interventions, particularly during this early adolescent developmental period. So I think the question becomes, how do we get at those positive impacts for youth during this period of time? We find that the answer often comes back to relationships. The extent to which we can improve a positive relationship across key individuals in a teenager's life, and that they feel comfortable, confident, and feel like it's actually easy and reinforcing to work together. We find that if we can create those conditions around a positive relationship among those key individuals in a child's life, like we showed here on this chart, we see improvements. This is the primary pathway through which we see improvements in youth mental health. So one of the main interventions I'm going to be talking about today is called teachers and parents as partners. We define parent in this and related work to include a guardian, a foster or adoptive parent, or any key individual who plays a role, a parenting role in the life of a child. So it could be a grandparent, it could be an older sibling, anyone who's serving in that parenting role. So within this teachers and parents as partners intervention, it's really focused, it's a very relational process. It's very much focused on building positive connections across settings, improving access to effective and supportive treatment that is aligned with families' values and goals, while at the same time connecting those interventions across home, school, in community settings. It's a very strengths-based process. We find that if we can start by building on strengths of the family, of the parent, of the teacher, of the teenager, that is really a primary area that we can then amplify into addressing any concerns that they may have as well. And in fact, we know that concerns or issues or problems that one or more people are experiencing always come up, but the extent to which we can really start and center on families and family strengths and youth strengths and teacher strengths, that is going to be the primary pathway towards promoting positive improvements on family well-being and youth mental health over time. The focus here in this intervention is really building parents and teacher knowledge and skills, strengthening that relationship, and then that leads to the promotion of youth outcomes. So if I was to present the logic model, that would be it. The intervention targets improvements in parent and teacher knowledge and parenting and teaching effectiveness, and the parent-teacher relationship, which then in turn leads to improvements in youth outcomes. We've done some research on this intervention over time and have found some promise for its use, but I'm going to be talking specifically about the early adolescent developmental period. One wondering we had when we started research on this intervention is whether it would only be effective for parents and teachers who already had a positive relationship. Sure, this makes sense for a parent and teacher who are already well acquainted with each other and are working well with each other. We actually found in this study that it was that the effect child outcomes in terms of the promotion of their social skills were more pronounced when parents and teachers started out their work together in this intervention further apart with regard to how they conceptualize their relationship. And so certainly it works for parents and teachers who already had that close and comfortable and positive relationship, but the effects in terms, at least in promoting child social skills, are even more pronounced for parents and teachers who started out the process further away with regard to how they conceptualize their work together. So I'm going to take the next few minutes to talk about 3 studies. I'm going to talk about this iterative process that we went through to apply some of these principles during that early adolescent period. I'm going to start with one study looking at grade 4 and 8 in a primarily under-resourced urban school, K-8 school. I'm going to then talk about a study where we worked in grade 6 and 8 in a mid-sized suburban area. And then I'm going to finish up by talking about how we built on those findings to promote this line of work during grade 6 and 8 in suburban and urban environments. So starting first with that study where we looked at working with schools in kindergarten to 8th grade settings, we used here the interactive systems framework for dissemination implementation. We were really interested in taking the teachers and parents as partners intervention and using it as a primary pathway to adapting empirically validated practices within the context of under-resourced urban schools and centering on family needs and priorities and goals. And we did that through following Abe Wandersman's interactive systems framework methodology, which allowed us to really focus on general capacity use, as well as innovation-specific capacity building that then guided us towards making modifications to certain interventions, while also using this family school partnership intervention as a primary approach to promote access and adoption of those practices. So here's just a brief figure that describes some of the adaptations that we made to within the support system and the delivery system. So here we used this process to make cultural adaptations to the teachers and parents as partners intervention itself, as well as the empirically validated practices that were incorporated within this intervention. We also made changes to the materials as well as the actual content of the approach. So we really focused on the actual content of the empirically validated practices, as well as the process by which those empirically validated practices were implemented, while at the same time partnering with school professionals, families, and youth to make modifications to these materials to support later implementation. And then the project team supported clinicians, mental health clinicians who are working in the schools to work directly with youth, with parents, and with teachers to implement this process. What we learned from this study was, I think, two main messages. One is that this intervention seemed to work pretty well in middle school in terms of reducing mental health symptomology for youth. So you can see 3 students that we work with here on this slide relative to ratings on different externalizing and internalizing measures. And so we can see some reductions based on some reporters for some students in certain circumstances. So for all students, this intervention worked in addressing their goals and mental health needs. Where we saw some needs with this project was around implementation. We found that the ISF, that interactive systems framework, was helpful for us in making adaptations and modifications, but that school clinicians were still not able to effectively implement the intervention, the teachers and parents as partners intervention to criterion. And project staff stepped in to provide significant support in implementing some of the systems and practices that underlie this intervention. So we learned that it was promising and that there was some evidence to suggest that it could work, but we also saw some needs primarily within the context of the capacity building system and how those innovations were adopted and implemented in schools. In the second study, we used a different design. We worked with a small number of students to really intently focus on how this intervention worked during middle school for students. So you can see all of their data presented here on this slide. And so you can see that when we worked with, and so as a reminder, we were working here in primarily suburban middle schools in the Northwest region of the United States. And we could see here that we saw a reduction in behavioral concerns for each student. So we have like a magnitude of effect. We use the non-overlap of all pairs magnitude estimate by comparing the baseline and intervention data for these 4 students. And we saw an improvement in their behavior within classrooms. And we saw that that parents and teachers rated the intervention positively, but we were specifically finding that teachers and other school professionals had some concerns with implementing the intervention to criterion. So similar story here in this study relative to the last study. I will say that based on the last study, we did make some changes in trying to better embed this intervention within the context of school-wide systems and structures to hopefully make it easier for teachers and other school professionals to implement interventions. They were able to implement many components, and I think probably some would say the core components of some of these interventions, but still there were some concerns with implementation over time. So the effects for these students may have been more pronounced had implementation been a bit higher in classroom and non-classroom settings at the school. Thanks for that question, Heidi. The intervention is not specifically focused on male students, but we do screen for students who have emotional and behavioral concerns, and we take the top number of students from that, and that's just how it's worked across these two projects, is that it's just happened to be more male students than female students, or students with other gender identities over time. So with regard to the project that I'll be kind of moving towards talking about next, we tried to use those data to design a project that was a bit more iterative in nature. So essentially in these other studies, we tried to use the ISF, we tried to embed some of these principles within the context of schools using kind of an implementation science orientation, but the data suggested that it was working, but not as well as it could have been, and we experienced some problems with implementation. So with this study, we tried to take a step back and focus more on parent, teacher, and youth perspectives of the intervention, make adaptations based on their feedback, and then align and integrate the adapted model into school and community settings, with the idea that this could be more helpful in terms of school staff and other professionals implementing the intervention. So here with this study, we used the Practical Robust Implementation Sustainability Model, or PRISM. So this allowed us to juxtapose the teachers and parents as partners intervention while considering program and intervention characteristics of the environment, the implementation process, and what the sustainability infrastructure looked like in these school and community settings to help improve adoption, implementation, and maintenance of this specific program. And so again, this is just a graphical depiction of PRISM and how we organized it within the context of this project. So at the end, I'll share an adapted version of PRISM and how we aligned and integrated it based on feedback from parents, from teachers, and from youth. So here's a quotation that a parent shared with us. And so this parent remarked, this parent was asked to describe what would be helpful, in terms of promoting your involvement in your child's school, your child's mental health services, or what would you like to see, better to help your kind of involvement or engagement improve. And so this parent remarked, talking about the classroom teacher, their approach was, let's try something and see how it goes. Then she'd come back to me and we'd tweak it. And then she'd come back to me again. So it wasn't a one and done thing. She really made it clear early on that she was going to stick with this. It was really clear to me that she recognized that only by working together, we could really solve this puzzle or crack this problem, because she knew she couldn't do it by herself and I couldn't do it by myself because I'm not in the classroom. So this quotation from this parent, I think, really captures the nature of the work that we're trying to do within this project with bringing parents and teachers together, coming at it from more a team mentality so that they could get on the same page, work together, collaborate, and hopefully benefit each other and the child with whom they shared a caregiving role. So the first of two studies I'll talk about from this larger project. So this was a qualitative study where we worked with we identified 8 students in grade 5 to 7 with elevated emotional behavior concerns based on parent and teacher report. We talked with 8 parents of those students, and we talked with 4 middle school teachers, and then we recruited these individuals through different suburban urban areas, schools that were located in suburban urban areas. We designed an interview protocol to align with the quality implementation framework. We were really interested in the quality implementation framework because we wanted to talk with these individuals about how they conceptualized family school partnership interventions in the context of different stages of implementation, from adoption to implementation to sustainment. And we felt like the quality implementation framework would be really helpful for us in guiding some of those discussions. That's how we designed the interview protocol. So within the protocol, we addressed primarily issues regarding feasibility. We also talked about barriers and facilitators and contextual fit. So we talked a lot with, families about how, what they wanted to see from their child's school or their child's community mental health provider, what teachers felt like would be feasible for them to implement in their classrooms, and how we could work together to design something that was really meaningful for them. Because within the teachers and parents as partners intervention, it's really a facilitator working with a parent and teacher to engage in a co-design process among themselves to design an intervention that's ultimately going to be implemented in classroom and non-classroom settings, in the school, in the community, and then at home as well. And so with the support of a facilitator, they are really actively engaged in that co-design process. So we needed to think really critically about the structure and form of the intervention while also considering what would make it easy or feasible and hopefully even reinforcing for them to engage in this process together. And then once they'd engage in this process and develop something, feel like it was actually feasible to implement in their home and in their school. We used a basic thematic approach to code, analyze, and interpret these findings. So, just a brief word about why we use this approach. I'm not sure if you're familiar with the show called Now Hear This, but I've always really loved the title because for me, it always really centers now period, here period, this period, which is really the approach that we try to take with these interviews, was really to center on youth, on parents, on teachers and administrators to just really better understand their experiences over time with each other, with education over time, to sort of think about how we could make changes to this intervention that would ultimately be helpful. Because I think too often we've seen problems with scale up or problems with taking an intervention that might show really promising findings in a series of efficacy studies to scale because there was a lack of kind of really centering on families or whoever the implementers and recipients are of a program. So we really tried to take this kind of human-centered, stakeholder-driven process that was grounded within this larger community-engaged process that we developed with these schools over time. And so that's that was kind of the context of how the study was conceptualized and designed. So here are some of the findings from this qualitative study. We found that individuals shared with us that this intervention and the partnerships in general seem to be relevant and would be helpful. Families wanted to work with their child's teacher. Students that we talked to wanted their families to be involved and wanted more support across different settings at school. I remember one student remarked that they just wanted somebody to kind of check in with them more often. It didn't have to be formal, didn't have to be through a screener or something really significant. They just wanted an adult at the school to come by and ask them how they're doing. And so there were a lot of, I think, really powerful messages that came out of some of these findings. People also shared that they really explicitly wanted to seek out and integrate parent, teacher, and student values and goals. That was really important within this intervention to center on their priorities when they were engaging in that co-design process. And also there was a sense that the parent-teacher relationship at this stage can be pretty strained, particularly for parents and teachers who share caregiving responsibilities for a student with emotional behavior concerns. We know that too often the nature of interactions that those individuals have likely shared over time tend to be more problem-focused and more negative. So within this intervention, it was going to be very important for us to reorganize that contingency, increase the density of positive interactions to, or even neutral interactions, and then obviously really emphasizing student voice. So we used these findings and made a series of systematic adaptations to this intervention, defining it as a triad with students as collaborators, streamlining the meetings, adding questions that were focused on family values and culture, and then adding a process for integrating affirming cultural identities throughout the process, discussing the peer context, and focusing on really feasible and streamlined supports for families and teachers as they work to implement some of these strategies. So then we moved to a small scale study where we that included 30 students with emotional and behavior concerns as rated by parents or teachers. And we recruited these students through middle schools in similar suburban and urban areas. So the procedures here in this study was that we were really focused on implementing this intervention across those 3 stages that I mentioned earlier, starting with that building on strengths interview. But with the adaptations that I talked about, that families and teachers and students provided feedback on, we allowed for flexible implementation. Much of this implementation occurred during the height of COVID. Some of it did not. But ultimately, we know that flexibility in modality is really important to improve access to effective treatment. And so we felt like this was an important avenue for us to consider and examine as part of this intervention. There were 2 conditions, this teachers and parents as partners condition and a school as usual condition. There were no limitations placed on the school as usual condition. It included typical school services. And then we did find much stronger implementation of the intervention in this study relative to those other studies that I mentioned earlier. So this, I think, is speaking to that the interventions that were implemented by parents and teachers in this process were perceived as more favorable, as more feasible, and could be implemented more effectively. When we looked at student outcomes, we saw that to a student, all parents and teachers and students rated their goals as being met. As part of this intervention, at least improved relative to where they started. There was also, we observed a significant effect on, so these are just preliminary, these are findings after our first post-test wave. We're continuing to collect data and follow these individuals over time. We saw improvements in externalizing behavior, internalizing behavior, and behavioral symptoms for students as well. We also looked at the parent-teacher relationship, and we saw some improvement in the parent-teacher relationship, primarily for teachers. We also looked at parent competence in problem solving, whether this intervention was effective in building knowledge and skills in partnership-centered planning and problem solving. And we found that there was some improvement there as well. And we also found that individuals reported that they overall found the intervention to be acceptable. This is just a very brief snapshot of some of the feasibility and acceptability data that we observed over time. But again, one of the take-home messages from this project was that implementation was significantly improved, and the pattern of effects for parents, for teachers, and for students was much clearer relative to those earlier studies that we conducted of this intervention in middle school before we had kind of really centered on PRISM and focused on an iterative design-based process that again was embedded within a community engaged approach with schools that we had been working with over time, designed this project with many of those schools and in collaboration with the district. It felt like there were a lot of really key ingredients that made this process work a bit better relative to some of those earlier studies that that we had conducted. So again, we felt like that there was some helpful lessons learned here. This small trial suggested improvements in proximal outcomes. We're still collecting data on these individuals while we're also planning for obviously larger scale studies of this work, but primarily wanted to share some of these findings as a demonstration for what happens, what kinds of effects we might find with regard to implementation and outcomes when there's not as clear a focus on systems planning and problem solving in the absence of kind of a really intentional family, youth, and school professional centered approach versus when there is more intentionality given to that process and more intentionality given to an iterative design-based process. And so this was how we adapted PRISM after we completed that small scale trial in this overall iterative development process. So we, of course, I didn't present those findings, but in addition to those quantitative findings, we all certainly did conduct semi-structured interviews with teachers, with parents, and with youth who participated in the intervention, and then made changes, another iterative cycle of changes based on their feedback. And so it was really those 2 iterations that led us to this this modification of the intervention. And so here I've kind of blown up the organizational features into this kind of prevention triangle. And really what I showcase here is that we found that this intervention was most effective based on the semi-structured interview findings that came out of that second study existed in situations where schools already had strong universal systems in place. They already had screening systems in place. They had roles and responsibilities focused on family-centered or family school support, focused on working with families, some intentionality around partnering, some support from administration that partnering with families was important and helpful. So in the presence of those kind of universal social, emotional, behavioral core components juxtaposed with those partnership-centered core components, we found that teachers and families found more success in aligning and integrating some of these systems within their homes and within their schools. But you'll also see here in PRISM how I've also pulled out the cultural responsiveness, mental health support, school and community systems. We also found that this was really effective when schools and community mental health centers had a bi-directional dialogue, and when there were mental health clinicians who were working kind of side by side in the school system. Because certainly for teenagers who engaged in this process, it was helpful for them to receive increased support at home and in the classroom, but for some subset of those students, they also needed some additional support through a clinician that might meet with them regularly. And so this intervention then was also used as a way to help with navigation towards more intensive treatment options for whom those treatment options would be helpful and effective. And so I think, again, one of the key lessons as I start to sort of wrap up here that we've learned over time is that that prevention triangle could be really helpful, that we do need strong universal systems, we need strong targeted systems, we need clear pathways towards intensive supports as well. But really what parents and teachers were telling us and what students were telling us as well is that they wanted more connections, more integration, more systematic clarity around how they could work together and how they could work together in a way that felt valuable to them, felt like it was consistent with their values and with their culture, and in a way that, and then when those key ingredients were in place, those were where they felt even more kind of comfortable and confident over time. But again, it's really for us in the context of this intervention about relationships, about focusing on strengths, and about creating connections and integration wherever possible. So just want to, I'll end there, but just want to make sure that we have plenty of time for discussion and conversation. I have some other slides that we can go into if we happen to have the interest or opportunity, but thought I would just pause here to allow some time for conversation or questions.
Thank you so much, Andy. I think Jane is going to kick us off with the first question.
I'll start with one question because I actually had about 8 questions in there. And I can come back if there's time or others don't have questions, I'll come back to ask more than one. But I was really struck by this idea that the time is a real factor in implementation and a barrier. And I think there's likely a trade-off between dose and adoption. And so my question was, schools always want to know what's the least, or any health system, what's the least amount I can do to and have this work. And sometimes they start doing that even without, asking. So I'm just wondering if you think a lower dose, which could take less time and potentially make it more adoptable, would be effective, or do you see other ways to deal with this intervention, the time and the adoption problem?
Yeah, I think those are great questions. And yeah, just reading through some of your comments in the chat there, I think there's so many good points there. I'd be glad to talk about. I think that, I think that's a really important question. And Absolutely. And that was one of the lessons. I didn't feature that lesson, but that was one of the other lessons that we learned during this series of studies, was that, this intervention was designed as this kind of 4-stage process, but we essentially reduced 4-stage process that included 3 45 to 1 hour meetings. And so essentially what we reduced that to during this most recent implementation was 2 meetings that were about 15 to 30 minutes in duration. And we it's a small sample. We're still collecting these data. We do anticipate that there will be some effects that haven't popped up yet that we'll, continue to monitor over time. Because I think that there were for some families received a lower dose than other families. And in some of those families who received a higher dose, we see more pronounced improvements immediately, but for those families who received a lower dose, we would still expect to see some improvement, but maybe not right away. And so I think it's going to be really important for us to continue to collect these data over time to monitor that relative to the engagement, because we did also monitor the dose or the amount of the intervention that each family, student, and teacher received as part of this process. So I'm hoping to do some more effects based on engagement with our current data, and then also moving forward as we continue to collect these these data over time. Another point that kind of comes to mind thinking about this question is that families tend to engage based on their needs and risk. We find that families are usually making decisions about how much they seek out support from a facilitator or a provider once they've already established a relationship. That's really important. Once they have that relationship in place, we find that families who need additional support or higher risk tend to seek out more support over time. And so I think there's this interplay between, flexibility in designing this intervention so that it is shorter in duration, that it does allow a clear pathway to promote that positive relationship at the beginning, but then also allows kind of other pathways, for families to engage more or less based on their needs and risk.
Andy, this reminds me of some work that Edmund Ramley and I are doing, funded by AHRQ, to support primary care practices implementing new pathways for screening and treating urinary incontinence. And what we've found is that time is so precious for everybody. And so what we're testing is sort of a streamlined version where we're seeing in our real world that even our streamlined is becoming more streamlined based on the needs, but that the practices that need more are requesting more. And so I think that that's a really important point for implementation and sustainment, that the folks who need more will take more. But if you set it up to not overwhelm at the beginning, you may reach more folks. I'm curious about the sort of equity implications in terms of like the schools that already had the robust infrastructure getting more out of the intervention. And I also wonder if the students as partners might be a way to sort of augment that in some way or mitigate the impact of that. I'm not sure what your thoughts are about those two concepts.
Yeah, we've thought really deeply about that. And I think it's, we have another project that's just starting in next month that is funded, that will allow us to do more at the universal level, do more school and community wide, that will, and this is, your point that you just made is exactly what I've just been thinking about as we've been gearing up to launch this project, is because it's, what we're kind of going in with is multi-component, complex. It requires multiple teams and systems, and providers to kind of work together, in a certain way to kind of make this happen. And so I think, so we often say, like, what's the smallest number of things that will have the biggest impact on, whatever our valued outcomes are. And so I think in this project, we're thinking about how we can create a set of core conditions school-wide that are partnership centered and will allow easier access, implementation, and sustainment of these kinds of partnership-based interventions for students with emotional and behavior concerns. And so that's, I think it's a great point. It's not something that we targeted as systematically in this project as I wish that we would have, but it is, I think, a really important line of work, and one that we've been tackling for a few years, and one that we're hoping to kind of just amplify into with this new project. I didn't answer one of your questions, Heidi, I think, or I didn't speak to one of your questions.
I'm just curious also about the role of the students. Like, it's so funny because it hadn't even occurred to me. And then when you said that the engaging the students as a triad, it was like,
yeah,
duh, right? Like, nothing about us without us. Like, of course, it's not really just teachers and parents as partners. It's teachers and parents as partners with students. And I'm wondering if students may be an untapped resource in those. Yeah, that was my question, is what, if anything, your team has discovered in qualitative work around that?
Well, I think it's just essential. Like, I think it's a game changer. I think once families and students are around the table, I think it's a, I was just meeting with a team this morning, and one person just remarked at how impactful, when they were able to establish systems at the school that allowed for students to have an active role in providing feedback over time about their school-wide systems, like how transformational that was for their process. Students were just sharing things that they never thought of. And it was, I think, it's just a real transformational experience about that. And so too, when we talk with students as part of this project, they, I think a lot of families of teenagers, are perhaps under the impression that, they want that, some may not want nothing to do with us. But these students were sharing how much they wanted their families and their teachers connected, and how much they really, wanted that support at home and school. And so I think, that's, maybe an important message as well. And we find actually that it's actually through when parents of teenagers who are in early adolescence withdraw, from their lives too early, that is actually a primary way to amplify social emotional behavior outcomes. So I think it's this real interplay between promoting their autonomy while also engaging in those effective parenting practices, and that we know are can be really helpful.
Thank you. I'm monopolizing, but Rebecca has a great question. You mentioned 3 key takeaways. Can you repeat them again? Building relationships, making connections, and
so I'll add, in addition to relationship, I will say building relationships and trust. I think maybe trust is assumed. If you're going to build a positive relationships, there has to be trust, but particularly for in the early adolescence period, again, that, whether it was their own child or their experience, parents and teachers have had many parents and teachers of students in middle school who have emotional behavior concerns have strained relationships. And so how can we reestablish trust in those relationships, increase the density of positive or neutral interactions? So if we can do that, I think that's really important. So I'll just say, like, emphasize relationships, but just know that trust piece is embedded. Focus on strengths, I think, is the second thing. Problems, issues, that's the reason why they're coming together, because there's some issue or problem that's become intractable that they want to address. The strengths, though, if we can remind families of, I just had this article that just came out recently in the Washington Post, where I try to kind of talk about the importance of kind of reconnecting with that parenting joy. And even for parents, like, reflecting on their strengths as a parent. And so if we can help as facilitators or providers remind families or parents of their strengths as a parent, help remind teachers of their strengths of a teacher, reconnect with their why. I think that can be so powerful. And if we can do that at the beginning, then it's those things, it's those strengths that we can then lean on to promote implementation of these interventions in homes and in schools, and ultimately, lead to more pronounced outcomes for youth. So I think it's focusing on strengths, emphasizing relationships, focusing on strengths, and then integration was the last piece. And I think essential to integration is communication. And so clear and effective communication, integration across providers, I think is those are the, I don't know if I count that as 3 or 4 things, but those are a few of the key takeaways from this line of work that we've been taking.
Thank you. Jane, do you want to close with a couple more questions? You've had some in the chat.
Sure. Thank you. One question I have is thinking about if this were scaled up, which it should be. This has tremendous importance and potential for impact. It's so needed. Are there policy drivers right now or mechanisms to help schools pay for the training and TA for this?
There are. We actually have just recently had a project funded, a scale-up study of this. So we don't have data, so I can't share. We're still in data collection, but we do have a scale-up study funded where we are examining this intervention. And it's within the context of this much larger scale study. It's a $4 million project funded by the Institute of Education Sciences, where we're really focused on training, capacity building, and integration across districts to help promote implementation and sustainment. As the project, we are working on this interplay between providing some resources while also primarily supporting school professionals in advocating for additional resources, so that by the end of the project, they've established capacity and are resourced to provide, this over time. So I would say it's an effectiveness trial. It's a scale-up study. It's also a conceptual replication study. And so I think it's all of those things. And so we are, still learning some of those things, as we're, working on that in this, larger scale project as well. There are some drivers, there are resources available for this kind of work, and actually increasingly funds and resources available, whether it's statewide or federal-wide. So many people are, have become more and more aware of the crisis that our country has been for years experiencing, that COVID amplified in youth mental health. And as a result, there's been an increased attention and resources locally and nationally.
So I'm going to ask another question, and because I could keep asking questions for a while, but I guess I'm wondering about sustainment within a school. So you have this support to get them going, but I'm presuming keeping that support going may not be realistic. And so how do you see schools, or is that something you're evaluating, how individual schools will be able to keep this going?
We are in the context of that current scale-up study. We've established, we've essentially supported districts in establishing a district leadership team that's then connected to a school leadership team that includes resources, but also direct connections around mental and behavioral health support for partnership-centered interventions that will occur at the school level. And so we're thinking about sustainment in terms of those teaming systems, the data systems, and the actual practices they're implementing. And so we're using that kind of combination of systems and practices to help districts and schools promote sustainment over time. Again, we're still collecting these data. This is very much in the midst of implementation. And so I hope in maybe 2 to 3 years, we'll have some findings to report on for that.
That's very cool. This reminds me in some ways of the work that Barb King has done with Move-In, because she was looking at systems interventions in the hospital, chaotic hospital milieu, to increase patient ambulation for older adults, and found that she could get, by doing this sort of holistic systems approach, you could get sustainment in crazy, chaotic, short-staffed hospital units. So I think I just thought I'd comment on that, and I think related to that, it makes me wonder about, are you able to look at, with your scale-up study, sort of the difference in readiness across schools? Because ideally, some schools that may really need this may be the least ready for it. And I'm wondering about how you'll be able to look at that.
Yeah, that's a great point. We are collecting those data at the school and district level. We'll probably primarily be able to look at that by school, but yeah, we'll be looking at that as a moderator. In terms of the influence that some of those different features of readiness, whether it comes to kind of their work with parents or their kind of social, emotional, behavioral universal systems like screening, and so we are collecting those data. I was just talking with a school social worker this morning, and one suggestion, one thought she shared on this topic was that it was much easier for their school to move forward with it because they already had systems in place to identify students with emotional behavior concerns. And for schools without that, it's going to take quite a bit more time to get those systems up and running. And so it's just one conversation, but I think it's really salient and important point. And those are the kinds of things we'll be looking at with those school-wide data.
And that also just circles back to equity, right? That perhaps the schools with the lowest readiness scores are the ones where you focus the most on figuring out what works. It's kind of antithetical to how we traditionally think about implementation science, but important stuff to be focused on. Andy, thank you so much. This was such a really wonderful presentation. I have put some links in the chat, some D&I Launchpad resources, as well as Felice shared with me the link from Dr. Garbitz's article in the Washington Post. So please click and check it out. If you don't have access, if you shoot me an email, I'll share it with you because I'm a WAPO subscriber. So you can email hwbrown2@with.edu and I'll gift you the article if you can't access it. Please fill out the evaluation before you leave. This is, as we mentioned at the introduction, a brand new seminar series, and we're really interested in hearing how it is so that we can make it better and hopefully continue it next year. So thank you, everyone. Thank you again to Dr. Garbitz. It's been so wonderful hearing more about your work, and enjoy your summer break.
Thanks, everyone. Thanks for the opportunity.